All right, well, it is the top of the hour, so I think we'll go ahead and get started. Welcome everybody in the room, and welcome to the folks online, and a special thank you ahead of time to Hannah for helping me get through this process here of being both in person and online. My name is Kate Anderson. I'm the head of the Zalk Veterinary Medical Library, and today's topic on a beautiful Friday afternoon is public access policy compliance. Then a compliance is always a great Friday afternoon type of topic. But if I could, I know some of you in the room, but if I could get just a sense of where everybody is from. Library school students? Yes. Yes. Library school? Where are you from? Which department are you from?
Education.
Oh, okay, great. How about you?
Also library.
Also library, and then we've got animal science and that. And what department are you from?
I'm a veterinary, the works in public health in healthcare.
Okay.
Before the word zoonosis was born.
Oh, excellent. All right. Well, thank you, everybody, for being here. As you might know, this workshop today is part of International Open Access Week, where we talk about how to make research more open to everybody. Today's topic specifically is looking at public access policies. And I always subtitle this talk, or Zen in the Art of Public Access Compliance. I've been on so many NIH webinars where they say, the way to comply is to comply. You're like, could you give me a little bit more detail about that? Or that you just have to sort of step back and say, I shall comply. You just kind of go through that. So we'll talk a little bit about how to Zen your way through some of these things. And you may know the one of the impetus for all of these public access mandates was the executive order from President Obama in 2013 from the Office of Science and Technology Policy that stated basically that open data is the default for government information, and if a federal agency has over $100 million in R&D budget, they needed to have a plan to make that happen. So as this has come online, federal agencies have dealt with this differently about how do they expect the research publications of grants to be publicly available, how do they expect data to be publicly available, and of course it is agency by agency. So one of the fun Zen things also is not everybody's doing it the same way, and so you need to know what is your agency asking for, where are they asking you to put the products of your research, when do they want it done. So for example, this is off of the library's public access guide. I've got that URL down at the bottom. That's kind of the starting point. Or if you just go to the library and put in public access, this will come up. And you'll see the variety of agencies and how they've dealt with things. So someplace like the Healthcare Research and Quality Agency says, okay, put that in PubMed Central. Lots of people say put it in PubMed Central. CDC says put it in PubMed Central. Then the DoD says, well, we have our own, and so you need to put it in DTIC. And the DOE says, well, we have our own too, and we have something called Pages, and we want you to put it in there. So we've given you this kind of a little bit of a chart of some of the more popular funding agencies to know where you need to put some of your items. And the two that we'll look at specifically today, NIH, how many NIH researchers in the room, or NIH wannabe researchers in the room? And then also NSF researchers. Oh, you're gonna come over here. And you'll notice that these two major agencies, NIH has long been using PubMed Central, and NSF that has recently come online says, we have our own. We're gonna go with the, I know, this was that, Chris, exactly. I was like, really? Really? Why not? PubMed Central is very well used, very well known. And so the NSF is using what they call the NSF Public Access Repository, which is actually based on the DOE's pages. So they kind of went a slightly different way. But when you're talking about how to comply with any of your funding agencies, you'll sort of see the same types of language over and over again about what you need to do and when you need to do it. So this is the NIH Public Access Policy, which has been in effect for a very long time now. And they sort of say, okay, if you get funding from the NIH, your articles need to make their way into PubMed Central. They need to get in there right when they get accepted, and then they have to be publicly available no less than 12 months later, and you have to comply with copyright law as the way to do that. So you'll kind of always see this cycle of where do you need to put it, when do you need to put it, and how do you need to put it. For NIH, it used to be when I would give these talks in like about 2009, people were really, really curious about when exactly did this start. And now you say, oh, April 7th, 2008, people are like, okay, yeah, that's fine. It's like, that's like a long time ago. If you have a grant now, you're going to need to do this. Very similarly, this is the NSF NSX policy and how they talk about it. And so this is fairly new still. This is for grants that have been submitted or due on or after January 25th, 2016. So these things are actually starting to come online and will do so more next year. And again, they want their items to be in their repository, the NSF Public Access Repository, which is in beta right now. They want the metadata in there, they want it to be able to be read by anybody no later than 12 months after the initial publication. And they do want the minimum set of metadata in there right away so that people know that it's going to become available. And that with that, you have to report this information in your annual and final reports. That's very common with any of the funding agencies. You get it into the repository, and then you need to tell your agency, hello, I am compliant, and I've been a good person, and I have done this. Now, just to step back a little bit more broadly, kind of to give the reason why people are doing this or what the original impetus was, the carrots involved in public access, and even a little bit more broadly if we're talking about open access in general, this is taxpayer-funded research. Shouldn't be behind paywalls. It should be available to any taxpayer who wants to go look at it. So these articles are free to anyone in the world. What that means in terms of like NIH funding, there are over 100,000 articles added to PubMed Central every year. So stuff comes online wonderfully with NIH-funded research. These things serve as central repositories. They're permanent archived. This is sort of the the national, hopefully, the National Library of Medicine isn't really going anywhere. So we're going to keep it forever and ever and ever, where a commercial publisher might say, sure, it's open access. And if they go out of business, then what happens to that information? And of course, this notion that public access and open access benefit science and inquiry because your information is actually getting out there. And as we are on a land-grant institution, I always think this dovetails very nicely with sort of our land-grant mission. Another way to think about this is just one of the very typical open access slides that you'll see, which talks about basically allowing other people to read your research allows your stuff to get read by people in developing countries who may not have access to these journals, more exposure for your work. You might influence public policy different if people can get to your items. So this is all the good. Oh, it's the beautiful, it's the lovely. The carrots. There's also the sticks. The funders are like, we're requiring this. And so now, NIH, if you do not prove your compliance with getting it into PubMed Central, you will get an email that says, and actually your institution gets an email as well. They're CC'd, OSPA is CC'd that says, hi, you have an out of compliant article, so we'll hold back your funding until you make that article compliant. For many years, they were kind of like, we won't enforce this yet. And now they're starting to enforce it. So I've helped a lot of researchers who forward me this email and they're like, can you help with this one? So what I want to do in this section is talk specifically about PubMed Central and how NIH works with PubMed Central to get these things into their open access repository. But you can, as we noticed on that slide of funders, there's a bunch of people who use PubMed Central as their repository. So some of this information carries over from funder to funder. So we're talking federal agencies. It is an alphabet soup out there, and once you start looking and scratching the surface of, oh, and then I need to get the PMC ID instead of the PM ID, eventually people are like, what? why are they all the same? Why did they name everything the same? So just as a little refresher, when you're looking at NIH Public Access Policy, you'll see things like the PubMed ID, or maybe you've searched PubMed, probably. It's like every day, all day long, I search PubMed. Every record within PubMed has a PubMed identifier, so that's the PMID, versus the identifier for PubMed Central, which is the digital repository for NIH. So then you'll see the PMC ID. You'll also see, we'll talk about this as we talk about ways to get things into PubMed Central. They use the NIH manuscript system, and then there's a variety of alphabets related to their progress reports and their compliance arms. Oh, and importantly, before I go back, you'll see that, and we'll see this come up a couple times, it's very easy to confuse the PMID and the PMC ID. And when you're showing your compliance for NIH, they keep asking, what is the PMC ID? And a lot of people will say, well, my PMID is this. And they're like, we were looking for the one with the C in the middle. And so the compliance aspect, or showing your compliance, is about the PubMed Central ID. And this is kind of the three-step process. This is also the sort of the zenning of it. There's always three things that you do. You prepare your manuscript, you deposit it somewhere, and you report it. And it doesn't matter the agency or the details thereof. This is kind of the thing that you'll do over and over and over again. And this is our brief interlude about copyright transfer agreements. Yay! They're so much fun. So the NIH has a very lengthy section on their page talking about, be sure that you have the right to deposit into PubMed Central. So as you are writing up your papers, I know it sounds crazy, but read the copyright transfer agreement. And I know myself, I'm a librarian, and I've written some things, and by the end you're just like, okay, I just need to get done. You're like, oh wait, no, I need to see what I'm actually doing. So this aspect of addressing your copyright before you submit your manuscript is the single most important thing to do with NIH Public Access compliance, because you have to retain the right to deposit your work in PubMed Central. And I've given you a couple of ways to find out about that. Sherpa Romeo is a great resource that will let you know what you can do with your work. Elsevier, if you're publishing with Elsevier, they've got a whole section on, if you are an NIH-funded researcher, here's how we do things for you. Wiley has similar. And then this is a great question to ask of your subject librarian if you cannot figure it out. We answer those kinds of questions all the time. So this is kind of what you're looking for if you're looking at the NIH stuff. Basically, Elsevier says, okay, as a service, we deposit to PubMed Central on your behalf. Yeah, great. I just need to tell Elsevier that this is NIH funded and it will go through the system. Wiley Blackwell has a slightly different take on it, where they're like, yes, we will do it for you, but we're putting in the accepted version of your articles to PubMed Central upon acceptance. More broadly, when you're looking at your copyright transfer agreements, you want to look for things that let you control your own work. Far too often, and this has just been kind of the way of scholarly communication, you say, I wrote this, this is my work. You're my publisher, I sign, and I give it to you, and now you have all the rights to do everything. Which seems a little crazy. So now you want to look to see, well, what am I actually letting the publisher do? So you're looking for phrases like, I grant the journal a non-exclusive license to publish my work. I understand no rights are transferred to the journal, or I understand that a Creative Commons license will be applied. Those are all sort of trigger phrases that mean that the author is retaining some of those rights. My beware there, some publishers still really just want the entire thing. And I won't say who this is, but it's JAVMA, which drives me crazy, the Veterinary Medical Association. Old school, old school. This is their current copyright transfer agreement. The undersigned authors transfer ownership of the copyright, including the right to publish and distribute the works by any means, method, or process, whether now known or to be developed in the future. Ah, so that's kind of a classic. Yeah, you don't see too many like that anymore. But what I want you guys to know is that if you don't like that agreement, you can actually amend it. And there's a great resource on the web from the folks at Spark that give you the language to say, and this is what I would go back with in order to negotiate my copyright. Any questions about sort of copyright transfer agreement stuff? Problems you run into? Yeah.
Well, so I've been, I think probably around at least before 2008, I've been paying the extra for open access in the journal. Does this mean I don't have to pay that and I can just make sure that it gets into?
Correct.
Because that saves like $2,000 to $3,000 per publication. That's like a huge thing. Wow.
Oh, perfect. It segues exactly into my next slide.
Oh, okay.
Awesome. Okay, so this question of making it open access is actually separate from complying with a public access mandate. Open access is wonderful. Immediate open access is wonderful because people get to your work exactly now. And I know a lot of faculty discuss when this article is going to be a really big hit. We want it out there free to everybody right away. Versus, well, this article may or may not be that, so we can wait for the embargo period. So there's always different things to think about. But when you're looking specifically at complying with NIH Public Access, there's all of these different kind of journals do it differently. And there's a whole series of journals that the publisher itself sends everything directly into PubMed Central. These may be open access journals that require publication fees. Right? There's a lot of journals where there isn't an option. It's like the BMC journals.
Oh, okay.
Yeah, yeah. So it's like, I want to publish in this journal, there is a fee,
yeah,
and it goes forward from there. But you can see that from the public access perspective, some journals will send everything, and the author doesn't really have to do anything except signal, hi, I'm NIH, and it will be pushed through, and what gets put into the repository is the final published article. There are other journals that will submit those articles directly to PubMed Central upon request, and these are usually kind of when you are paying the optional open access fee, like Wiley Open Choice or Elsevier Open Access, where the whole journal itself is an open access, but you can pay additional to get the that item into open access right away. And there again, they give you the final published article. There are a few journals that don't help you out at all. And those are the tricky ones where you have to make sure that you retain the right to deposit, and then the publisher says, okay, well, good luck. Don't call me, and the author does everything. You put it through the manuscript submission process. Often, what you're able to do is submit your final peer-reviewed manuscript. How many people keep their final peer-reviewed?
And it always does something stupid that you have to change in the proofs.
Yes. Yes. And so, and part of what the publisher's argument for that is the value added comes from us doing the copy editing and putting it all in there. And so they're like, well, yes, you can put it in the public repository, but it's going to have your done thing. It's going to have that figure, not quite right. But it's just really important to know which version you can put into the repository. And similarly with Method D journals, like Elsevier and Wiley do this. They're like, great, we'll start the process for you into the NIH manuscript system, and then the manuscript system basically emails you to say, hey, you've got a publication in here, do you want to keep pushing it through the system? Just a couple of different examples. Method A journals like PLOS, they stick everything into PubMed Central. So the BMC journals or American Journal of Physiology, things where you can purchase sort of pay for the open access fees, are often things like Nature Publishing Group Open Access or ACS or Author Choice or Wiley Online Open. And then some of the big players, the Elsevier, Nature, Sage, Wiley, they'll start the process for you. They know that they don't want to kind of ball up this issue when we're talking about the NIH funding. This is also another little Venn diagram. They say it so easily. Oh, just put your thing in the NIH manuscript system. It's only 5, 6 easy steps. And it like kind of goes around. But the thing that's important in there is that email between the 3 and the 4. You need to approve stuff when it goes through this system. And as someone who works on this sort of behind the scenes, I have the institutional look at all of the NIH grants on campus to see if they have things that are in compliance or out of compliance. And it's amazing how many things get stuck in that middle part where all it takes is someone to go log in and say yes. So people are like, oh yeah, I got that email from NIH, but I never did anything with it. Really? That's your funder? Yeah. Pay attention. And then when you need to comply on this, you can use the My Bibliography within my NCBI to kind of connect everything to say, this article relates to this award, and this is how I'm going to signal that I'm in compliance with my grant. And again, when you are signaling your compliance with NIH, remember that the PM ID is not what they're looking for. They're looking for that PMC ID, because that's your evidence of compliance. And when you go for your next round of NIH funding, when you're doing your biosketches or your renewals or your grant applications, they are expecting to see for your work that PMC ID as I've been a good person on my grant and I'm complying with the rules and regs, so that you can say that you've got the proper number.
I have a question.
Yes.
What if you had like some things were published with USDA funding, but you want to apply for an NIH grant and you want to show those publications? Should you submit it? Are you allowed to submit it to the system if you're not NIH funded?
You can't. It will depend on. It often depends on the journal and how they. NIH doesn't necessarily want absolutely everything into PubMed Central, but now with various funders coming online, it's often in there already, and so there's a lot of journal articles that are based off of USDA research that are in PubMed Central. Yeah. And then with NIH, these are the kind of the common mistakes that people often make. And I know that the first one seems, who wouldn't do that? But a lot of people, you're writing with a big group. You aren't necessarily the corresponding author. It may be your student who is on the paper instead of you. But just making sure that you actually, when you're first submitting that journal, to say, this is based off of NIH funding. And that will help ensure that everything gets through the process. In the past, when I needed to help kind of clean up stuff, often it's like a T32 grant where the PI isn't even on that paper, and it's a student who has sort of forgotten to signal to that corresponding author, oh yes, I'm NIH funded and I need to do this. On the other end is actually over-acknowledgement of an NIH grant. And you understand what people are doing, like in their acknowledgments they say, my lab is funded by the NIH.
Just the global.
The global, you know, and so when it goes through the system, all the machine sees is funded by NIH. And so then it tries desperately to be like, okay, you said that this was funded by NIH, even if that particular article may not have come out of NIH funding. And so sometimes we've had to like break the cycle of like, okay, yes, other things that this person has done has been NIH funded, but not this particular review article, for instance. So just acknowledge the right amount. Also, just thinking that submission will be done automatically, because a lot of faculty, they're like, well, the last 10 articles I did, I didn't have to do a thing, you know, and it just went through. And then all of a sudden they're like, whoa, number 11, whoops, you know, I didn't. And then they start to get these little, hey, you're out of compliance. They're like, I don't even know what method submission I'm supposed to do, and sort of backing up and having to do that. Again, using the PMID instead of PMCID, not retaining the rights to deposit initially, also not keeping that copy of the final peer-reviewed manuscript, which can also be very difficult when you're writing with co-authors. You may or may not have that kind of last version before completion. And really, if NIH emails you, you should respond to them. And here's what I was talking about, that behind the scenes, the institution does have a way to look at what's in compliance, what is compliance, what's in process, what's not compliant, and where things have gotten stuck along the way. So I can help faculty get things unstuck from that. Questions about NIH and how it works?
Well, what about public-private money that's being offered to, say, a pharmaceutical company that's got some vaccines, you know? How are they going to do it? It's proprietary stuff as well as public funding.
Right, that's an excellent question about partly about what even gets published from kind of proprietary funding mechanisms. From the NIH's and the federal agency's perspective, if there is a cent of money that has gone into, federal money that's gone in, it needs to be open. I don't know, Chris, if you can speak more to that about proprietary fund, or how often that happens.
I don't really have experience with that. Everything that I have done is in public. Jerry Taylor would probably be a good person to ask. In the next office next time.
Because often I would say that sometimes the straight up proprietary funding may not come into the literature as quickly, right? That you're doing the reports for them and not necessarily writing for the journal articles, if that makes sense. But if for some reason someone was funded, one research product was funded by both NIH and a pharmaceutical company, it would need to end up in the public repositories from the NIH perspective.
And I think when somebody would apply for funding from NIH to do that, it would be known at that time probably where the other funding was coming from, and there'd probably be some kind of policy up front.
Except it's not a person applying, it's like the federal government, if they get smart, are going to say, we need to give you incentives to develop this for our own public health.
Yes. And there is kind of the separate issue of, I don't know if you've ever looked at clinicaltrials.gov, and that is an open repository, and it does not matter where the funding has come from. So pharmaceutical companies, once they have any kind of clinical trial, they need to post their results into clinicaltrials.gov. So it's a little bit different from kind of the journal article aspect, but you'll still see their information on. It's a really cool website. So that's the NIH, which has this quite complicated copyright situation and all of these different methods of different journals. And then we switched to the National Science Foundation, and when I started looking at this, I'm like, this seems far fewer steps than the NIH stuff. And there are some sort of key differences that you're like, okay, they have some philosophical differences at the outset. So for NSF, and again, this has just started, so grants that have kind of kicked off in 2016, the products that come out of there. So peer-reviewed journal articles and jury conference papers is based whole or partially on NSF support, needs to be into NSF Public Access Repository, or NSF PAR, and the PI deposits the accepted manuscript or a version of record as a PDF. And what the PI does is you log into research.gov with your FastLane account, and you copy and paste the DOI of the article and attach the PDF. And I was like, really? Is that it? Is that all? Like, and that's.
So it's all the it's the finished article. That's nice.
It could be the finished article. Partly because when an NSF gives you a grant, way at the outset when they give you the grant, there's this question about who owns the copyright for the journal articles that arise from NSF grants. And very similarly, it says, unless otherwise provided in the award, the grantee owns or may permit others to own copyright subject to the federal government's license. And then their next Q&A is, and what is the federal government's license? You're like, okay, that sounds nice. And so the federal government basically keeps a little bit of the right to have copyrighted materials included in a repository for federal purposes. And so even before you get the grant, or as you get the grant, they're keeping hold of that little bit. And so their repository is kind of a little bit different. And so when you go through and you put in your publication information, you deposit your version, and then you select the award, which connects it. That's kind of your reporting feature. You say, this article came from this grant, and then you say, I acknowledge the federal government's license as set forth, and then off it goes. What they'll look like in the repository itself, if it is a freely available article, like it's an open access article, what NSF PAR does is it just links over to it. It says, okay, yeah, this is available over here. If for some reason that website went down, wasn't available, NSF still has the PDF that you deposited, and then they would bring that up if they needed it. That second one says in very small letters that this will be free and publicly available as of October 1st, 2017. So this was in a journal that is not an open access journal. There's a paywall on that. So in October, they will actually post the PDF that the author submitted. And so unlike PubMed Central, which actually has all of the information in it, publicly available, you go in and you see, here's the PMC version of it. NSF kind of will point in different directions. It'll be like, okay, well, I'm just taking you over to the publisher's website, or, okay, we're going to show you the PDF that the author had originally deposited. Questions about that? Kind of a different flavor of things.
So, and so the NSF was, it's for any grants funded after January 1st this year.
Mm-hmm.
Like for the current fitness, if you have a project that started sooner, we don't have to enforce that on our participants.
That is correct. They, of course, encourage you to just go ahead and get started, but it's not, it's only for grants given after January 25th, 2016. And then there's always this question, and it goes a little bit back to your question about multiple funding agencies. And there are lots and lots and lots of journals where you're looking at lots of co-authors, and one person has NSF money, and one person has NIH money, and somebody else has this kind of money. And there's this question of, do we have to put it in all the different repositories? And the answer is yes. Yeah, so, because the NIH is going to look at PubMed Central, and they're going to say, all right, good job, Hannah, you're compliant. And then if you had NSF, if there's any kind of NSF funding, they would look into PAR and say, well, where is it you're not in compliance? So on all of the FAQs from the various things, they say, well, more than one federal agency gave this to me. Do we need to deposit a copy at every agency that supported the research? And then you do one thing. This is the government. Yes, you do. Because they're all looking at it from their particular silo, and so they want to know what that is. But it is, and that's just the most important thing, this last line about consult the policies of your funder and all the other funders. And then it makes it interesting when you've got many people on an article, how to kind of corral that from the beginning of like, okay, how many co-authors do we have? How many different pots of agency money do we have? Is this all eventually going to go into PubMed Central, or is it going to go both into PubMed Central and to NSF PAR? But that's a good problem to have, that you've got all of this funding for your work. What questions do you have? Anything you want to see? I can live demo stuff. Problems that people have run into.
So do you know if USDA is going to be going in this direction, or were they on the list? They were on that list with each one, were they?
Yes. And so Hannah will do her magic over here. No, I just don't know. I don't know how to like flip things around. Make sure that we can. Yeah. All right, folks online in the recording actually show that.
We can see it.
And so the USDA is working on something called PubEgg, the Public Access Archive System. And so they will have their own special snowflake repository to put things into. Again, sort of that similar 12-month embargo that way.
That's not in effect yet, right? Like for, let's say, existing.
I don't think so, actually. I think, and Noelle Capriva, the Kaffner librarian, I think is, and I know she's been doing some work on PubEgg to sort of see how it's doing. I mean, it is up in there. Let me go back one here to see, and I'm just gonna, so what we have on this page is on the agency links. These are all links to the public access policies of the agency, so you can look at the details, and then these links are kind of which repository are they going to. And they all kind of read like this: the implementation of scientific research. But I can follow up, Chris, to see when. I don't know off the top of my head when.
I haven't gotten any emails about it.
My thought is they're still working on it and they haven't given that hard, you know, and really, like, NSF's just came out not that long ago. So it's been, even though the memorandum has come out 3 years ago, it's taken people a bit to get online.
I would just add that we're starting to see, and this is both in and out of the science, some of the private funders, especially the ones that are coming from more philanthropy perspective, are starting to have open access policies for things funded by that. So the Gates Foundation, for example, has an open access policy.
Yeah, and the Wellcome Trust and HHMI, and there's a bunch of different ones. And again, it's kind of that same process. Make sure that you have the rights to do with your work what you need to do to comply, know where it is that you need to put it, and kind of how you need to show your agency that you have complied with that. I can't remember if Gates uses PubMed Central or if they use something else.
I think I have to look at their core policy. I think they offer some different options depending on what the funding is for.
That was the plan. I am not exactly sure that, but I'll follow up and get back to you. Other questions, comments? And often it can seem very easy to do when you're sitting in a room and it's not your exact thing, and then later you're like, what? Like, what do I need to do on that? So you can email me and say, how do I do this?
Like when I the collaborations I've been in, it's like, it seems like the habit for like the funding paragraph to be like at the last minute, like it's already been reviewed and accepted, and it's like, oh, everybody quick, send me your funding source. And then by then it's like almost too late, because I know that like it was the first time that I noticed last year when I submitted a manuscript, it was on the submission page.
Yes.
What is the funding agency? And I don't remember doing that before.
They have started to really, like the manuscript submission processes have really started to front load that as you are even just putting in a manuscript for review that says, okay, what are the funding agencies? Because they know that they also want to be helping, like Elsevier will help you get through the process, but you have to tell them that it's NIH money, and then they'll kind of go through that way. And I have seen people get caught in the loop where it clearly says on, you look at the PDF and it says acknowledgements, this was funded by R01, and it says the funding number, but that person did not at the beginning check the little box that says, oh, this is NIH funding, and so it never sort of got pushed through the system, even though they felt like, I told you, I wrote down the number on there. You have to kind of tick all the boxes.
There's another thing I noticed is that it was very specific hired in that paragraph. It was like you were not allowed to change it in any way, and you know, like the exact sentence was there, but you kind of like filled in funding agency and the word number. But what we have at USDA is that they have a requirement that you must word your acknowledgement in this way. And so the first time I submitted it, I worded it in the way that USDA told me to do it, but then I was required to change it. So
competing agencies. All right, well, that's about all I had for you guys today. Next week, we'll be looking specifically at the research data side of these things, both from the public access policies, and when you talk about the article stuff is really quite, you're going to do it here and you're going to do it there, and this is what's going to happen. And the data repositories are a little like, well, something that's appropriate, and so that can be a little bit harder to figure out. Where should I be putting my stuff, both for complying with your granting agencies, but also just making sure that all of your research data is together appropriately and that you're sharing and managing that appropriately. All right. Thanks for coming, everybody.